Hi, I'm making a presentation of speech on the topic coronavirus. What is coronavirus? It belongs to the family of virus that causes illness in human, such as respiratory problem or gastrointestinal diseases. It's basically the crown shape as it's contained in the Latin word corona, which means crown. To further hurt, let now let now go to its history. Basically, it originated from a lab in Wuhan, which is a state in China. It adversely affected the people in China and it eventually spread around corner of the world. Today, researchers are still trying hard to develop a vaccine in some countries. The trial have been successful. A very large number of cases have been reported each day, and deaths can also be seen in large numbers. Clinical presentation of the virus. Coronavirus has presented respiratory symptoms in the individual along with other symptoms. There are also majority of people with no symptoms, but when tested for COVID-19, they are found positive. In majority of coronavirus cases, the symptoms are flu-like. They include respiratory symptoms, fever, cough, shortness of breath, and sore throat. Some minority of people some minority of people will have severe symptoms and require hospitalizations. These symptoms include much difficulty in breathing and persistent pain in chest. High risk population is also one of the factors we have to look when considering coronavirus. Generally, this virus is harmful for all age group, but the people age 60 are at higher risk of being affected because of very low immunity in this class of people. People which have some previous diseases history are also adversely affected. These diseases include chronic liver diseases, respiratory illness like asthma, tuberculosis, heart problem, hypertension. These people require immediate hospitalization so that the disease can be controlled. How coronavirus is being transmitted? In very simple terms, it can be understood that COVID spread from human to human transmission. The virus present in the lungs of an affected person, and when that affected person sneeze or cough, the virus comes into droplet, which other normal person comes in direct or indirect contact with can be affected with the aerosol particles. Then he or she get affected. Basically create chain of transmission, which if happen, it commonly spread of diseases. These diseases as can be prevented from spreading from one person to another. It rightly said that safety is better than cure. Hence, let's now discuss some precaution measures to stay safe from this virus. Sanitize your hand with the help of only alcohol-based sanitizer. Wearing of mask, gloves should be mandatory while going out. The gloves should be used only once. Change your clothes when you come back home. Maintain at least a distance of 2 to 6 feet from people and avoid handshake and greeting closely. Or sore throat. If, if you have fever or sore throat symptoms, consult your medical doctors immediately. and never neglect the symptoms. Maintain at least a distance from people, and if necessary, just say hi from your distance. Cure. It just includes symptoms-based treatment, and as of now, there is not any particular medicine or vaccine developed to provide you immunity from this virus. Safety is the only best possible way or remedy from this coronavirus. So to stay clear of this coronavirus, it's highly necessary that we all should maintain a proper high standard of hygiene. Thank you. This is my end of presentation. Yeah, till we meet again. Bye.